My name is Hallie Duncan, and when I was 17, I experienced homelessness for over a consecutive year. Over this year, I was able to learn what these homeless people truly go through and their experiences with homelessness. There were nights where I did sleep in my car and where I didn't know where I was going to stay at night. But still, I was able to graduate high school, and now I go to college here at Boise State. When I was homeless, I experienced just a fraction of what other people go through. But experiencing this firsthand has allowed me to advocate for change and look for possible solutions. Homelessness is a persistent issue that affects children's, families, communities, and individuals. It's time to take preventative action and to stop the homelessness epidemic and keep people happy, safe, and healthy.
So how are we going to solve this issue? The Housing First model is an approach to assist the homeless by providing permanent housing with no readiness requirements so that the individual can improve their quality of life and pursue their goals. Now you might be thinking, we can't just give all the homeless people houses. The Housing First model does prioritize individuals who are chronically ill, mentally incapacitated, or substance abusers who have experienced repeated or chronic homelessness. However, this is why we have developed other preventative programs such as rapid rehousing, PSH, permanent supportive housing, and transitional housing. These programs can be used along with the Housing First model to ensure that as many individuals are being kept as safe as possible, while still trying to ensure the best quality of life. So, how do we know these programs work? The National Alliance to End Homelessness states a variety of studies have been shown between 75% and 91% of households remained housed after a year of being rapidly rehoused. By allowing these individuals to stay housed, this option opens opportunities for them, such as finding jobs, continuing school, and starting training programs. Just think, would you be able to continue going to school, working a job while you have no place to sleep at night? By opening these opportunities, it allows for the individual to help discontinue substance abuse and find programs to stay healthy. So, who's going to pay for all of this? Well, the consumers, you and me, are paying indirectly for the cost of the homeless through taxes, cost of goods, and cost of services. Consumers pay the public services and organizations that pay for the homeless. The federal, state, and local governments are the people controlling the public budget and decide how to allocate the money. Now, you may think that the Housing First model is going to cost consumers a ton more money. However, we have actually found this to be quite the opposite. The U.S. Department of Housing and Urban Development, or HUD, is the federal agency that is in charge of creating programs and housing policies to assist in homelessness and other housing needs. Some of these individuals have advocated for the Housing First model, saying that this could actually be a cost-saving solution in finding permanent long-term housing for many homeless individuals. Right now, consumers are paying for the homeless through their emergency room visits, jail stays, emergency response, and emergency shelters. On average, consumers are paying over $30,000 per year on expenses going towards the homeless. This cost can be greatly reduced by implementing preventative programming. When the preventative programming is implemented, we see expenses reducing down to $8,000 to $12,000. This is because with preventative programming, there are less emergency room visits. Homeless individuals often use emergency services because they do not have access to primary care. When they are housed, they are able to access health care and avoid unnecessary and expensive ER visits. There are fewer police calls and jail stays. Homeless people are often put in jail for unnecessary and nonviolent reasons. This can be such as trespassing, loitering, or public camping. The use of shelters also reduces. Running shelters can cost millions of dollars annually, and permanent housing will reduce the demand for space in shelters and allow for more space. The Housing First model allows for more individuals to be housed and break the homelessness cycle. This provides long-term stability and costs consumers less overall. By breaking the cycle of crisis response in the homeless community, taxpayers' costs are reduced. This can show how the Housing First model will save consumers money and is an efficient solution to homelessness. For the interview segment of my genre project, I decided to bring in my friend Carly Pierce, who has also experienced homelessness firsthand. I compiled 5 interview questions touching on all aspects of homelessness, and I did not record the audio of the interview for privacy reasons, but I did compile together a summary of her answers for each of my questions. Question 1, How do you feel being homeless has affected you for the rest of your life? She said, it had changed my outlook on life. It made it harder to get back on my feet, if that makes sense. I didn't have a job. I didn't want to go to school. It had felt like a hole that I couldn't dig myself out of. I had lost myself. It had messed with my head. These were some of the hardest days of my life, and I had learned to grow and accomplish different things from these experiences. And being able to work myself out of that cycle is now my biggest accomplishment. Now, I especially look forward to going home at the end of my days. When you're homeless, there's so much uncertainty. These nights where I was worried about where I was going to sleep, I would take advantage of pretty much every opportunity that was given to me. I feel like this experience has made me especially grateful for what I have today, knowing that I have earned it myself. Question 2. Were you made aware of resources and/or programs that were available to you? She said, yes, I was lucky enough to have the social worker at my high school provide me with several resources, things such as gas money, food gift cards, along with a list of shelters I could go to if I ever needed. She said that she would be able to provide me with warm clothes and that we had a food pantry at my high school that was available to everyone. I was completely unaware of all of these resources and options until they were available to me. I wish that these programs were talked about more so that individuals who were too afraid to speak up could have the same opportunities. In high school especially, I understand not feeling comfortable telling adults and peers about homelessness. Understanding the importance that it is okay to ask for help needs to be implemented in schools. They can make students more comfortable with this by providing these resources to everyone, regardless of their situation. Question 3. What did you find the most difficult to do while continuing to work a job/stay in school while you were homeless? She said, I feel like the hardest thing to do was trying to care about my schoolwork. Going to school and pretending I was fine was extremely challenging. The hardest thing to do was to find the motivation to really do anything. It felt like I didn't have anything in life anymore, so why would have homework mattered? Participating in class and having a good attitude at school was one of the hardest parts. Trying to put on a happy face for my teachers and my friends while truly I was going through hell. How was I supposed to just be happy? If I was 100% alone and had to go through each experience alone, I don't know where I would be at today. I have been able to find the motivation to return to daily activities and take care of myself. I'm now working a full-time job and began doing so after I wasn't homeless anymore. Question 4. Do you feel that broader access to the Housing First model and other types of preventative programming should be necessary to implement, and if so, why? I feel like this should be a standard. This should be the bottom line for trying to reduce homelessness. Preventive programming and programs like Housing First are the only way that we are going to see rates in homelessness go down. Not to mention the amount of money that it would be saving everyone. Housing First should be more accessible to homeless individuals, especially families with those with disabilities. In many cases, these people need urgent medical care, but providing them with this basic standard of life, these people can get back up on their own feet. Question 5. What structural policy changes do you feel could be made to improve access to prevention programs to at-risk individuals? She said, I think that more awareness should be made around the topic of preventative homelessness programming and how extremely cost-effective and reduces rates significantly. I think that if more people realized this, then we would be able to fight homelessness one step at a time. The government could even provide specific funding for individuals who are homeless, raising awareness over the different options that are provided to the homeless, such as rapid rehousing, public funding, and other specific types of government assistance that are necessary for the community. Ensure that the homeless are made aware of these opportunities and how they can take the steps to breaking the cycle. This is what I would do.